The inside of the heart is one of the most harsh environments inside the body.
It's extremely dynamic, constantly expanding and contracting.
Let's say it's a hurricane of blood inside the heart.
Of all the places you can perform an operation, the heart's probably one of the hardest. It's even harder when that heart is very small, like in the chest of an infant, 10,000 of which require open heart surgery every year.
If you want to repair a heart defect, basically you need to open the chest of the baby, expose the heart to suture the defect that can cause a lot of damage to the tissue.
We're really compelled to try to do something to solve this problem. And so we went off and developed this adhesive that could work in the harshest environment in the body, inside a beating heart.
In 2009, a team at MIT was asked to solve a problem. How can you repair a hole in the heart of a child without using stitches or staples?
You're setting out to create a new kind of adhesive. What were you looking to create? What were some of the properties of that adhesive that you needed it to have?
A lot of materials can react with blood and therefore would not be able to attach to the tissue. The material that we've developed is hydrophobic, and what that means, it can actually repel water, repel blood. So we can place this inside a beating heart, and then what happens is that it will actually start to infiltrate into the tissue. It's almost like a tissue Velcro, so it just locks into the tissue. And then the heart's actually expanding and contracting, on the order of 60 times a minute, and so the materials have to be able to respond to that.
Why don't you tell me a little bit about what this here contraption is going to do?
So this is a mechanical tester. We can grab the tissue and the patch, which is cured with the glue, and measure the adhesive force that the glue can generate.
So you're actually going to be able to get a reading of the level of adhesion, as it were.
Yes, exactly.
We see that our adhesive can sustain around 2 kilograms of force per square centimeter, and that's strong enough to remain in the heart septum.
You can see that the top of the tissue is bent up.
Gecko's glue needs to be strong, but it also needs to know when to get out of the way. And that's what makes it particularly impressive. The glue can work with the patient's own body to help create an even better permanent fix.
What happens is that as the material degrades, the patient's own tissue forms a bridge, and that seals the hole, and eventually the material is completely gone, and the patient has their own tissue that's sealing the hole.
So besides working within the heart, there are other places where this technology could go. Can you tell me a little bit about that?
In terms of other clinical applications, there's many things that we can think about and that we are currently exploring. For example, when the clinician needs to bring two vessels together, we can apply our glue to seal the leak. We can also think about other approaches. For example, an ulcer in the stomach, we can use our adhesive. It really facilitates how the surgeon can work and can give him a lot of control over the surgical procedure.
We formed the company, Gecko Biomedical, to translate this technology, and we are determined to try to get this to patients as soon as we can. It's actually scheduled to be first-in-man testing later this year.
Gecko's hope is that widespread use of their product, besides making the company a lot of money, will lead to fewer invasive open surgeries, cutting down on recovery time for patients and reducing the risk of infections.
The dream of every person that does science is always to translate something to the clinics. And I think the most exciting moment was when we were able to show that we could stick these patches inside a beating heart in a live animal. Of course, it was the moment where we knew that we had something that could really impact the quality of life of patients.